And welcome back. Now, although progress has been made in the fight against HIV and AIDS infections over the years, there are still many gaps. Globally, only half of the 52% of children living with HIV are on life-saving treatment, which is far behind adults, where 76% are receiving antiretrovirals. Now, this is according to the joint United Nations Program on HIV and AIDS, a Global AIDS Update 2022 data that was released last year. So to highlight the slow progress being made in the HIV/AIDS treatment for children, South Africa's Global Alliance plan to end AIDS in children is being launched in Durban as part of the 11th South Africa HIV/AIDS conference. So to talk to us more about this, we're joined virtually by Christine Muhigana, who is UNICEF South Africa's resident representative. Christine, good to speak to you once again. Welcome to Morning Live.
Good morning. It's very good to speak to you about this very important topic today. Thank you.
Very important indeed, Christine, because, you know, when we generally think about HIV and AIDS, our focus naturally tends to be on adults. But children, perhaps, you know, we speak to as a by the by almost. So just looking at the statistics, they are, of course, very worrying.
They are worrying, as you were saying. While we're making progress in putting adults on treatment and keeping them on treatment so that they can go on with their productive lives, unfortunately, much less children are on treatment. This is a worldwide trend, but it's also happening here in South Africa. So what we're doing here today during the AIDS conference is raising awareness of the situation of children and making sure that the attention, the resources, the investments that are put in the response to end AIDS globally also make sure that there is an impact and an attention to children. Children tend to not be able to speak for themselves. They will not be able to come up and say that something is not being done right to them. So we're here to raise the awareness, raise almost the alarm to say children are not getting the treatment that they deserve. Children are continue to be infected at a rate that is unacceptable, considering the knowledge that we have, considering the resources that we have.
And I'll come in just a moment, Christine, to today's launch for that Global Alliance plan. But, you know, just sticking with children and things like testing, for example, that is obviously a question, because when we look at the statistics, how accurate are they actually? Because naturally, we don't think of testing children for HIV and AIDS, unless, of course, they are born HIV positive, one would imagine, or there's been, an act that a child has been exposed, and therefore one would think about testing. But children being children, we look at, for example, the pregnancy rate among teens and preteens in South Africa, which is astronomically high. And how many of these children are we actually testing, apart from the ones who are falling pregnant, for example?
Well, what we know, the reality is that there are at least 90,000 children out there here in South Africa, in communities in South Africa, who have been tested, but we know they're not on treatment. They're not being followed up, following the positive test that they've had. So that's something that's there. It's a fact. It's evidence. And we need to make sure that we know where these children are. We need to make sure that we reach the children, because at some point they were in contact with a health facility. They were tested positive, but we know they are not on treatment. This is between 90,000 and 95,000 children here in South Africa.
And, with regard to the infection rate among children, Christine, you look at 2021, estimated 160,000 new HIV infections in children aged 0 to 14 years old. That is a very bleak picture. And if we could maybe just, again, look at the South African aspect of that particular statistic.
So what's behind that statistic is really mainly, and that's why we want to focus on adolescent girls, the reluctance that some girls, younger girls, will have to go and seek support or health care if they know they have been infected by HIV. We need to make sure that they feel comfortable with the type of health services that are available to them, and that's why we support approaches, we support programs where we have peer mentors in health facilities so that we overcome this reluctance, this hesitancy that young girls have to come to a health center, a health facility to seek support. We also need to make sure that the support or the programs that we provide to young girls who've been infected by HIV/AIDS are based in the community, are based in areas where these young girls feel comfortable to talk about what's happening to them and to seek support and help.
Christine, one of the issues that has always been, of great concern is when children are born HIV positive. And they know this. In some instances, I remember doing a program a few years back with some children not even knowing, where there wasn't, a clear explanation as to why, for example, they were on medication, and children not even knowing their status, even though they may have been born HIV positive. And then you fast forward to the pre-teens, the adolescent stages of children's lives. They may become sexually active and they don't know. And there's, of course, then again, that window of opportunity where children may unwillingly or unknowingly, unwittingly infect other children or, other people. So what are we doing in that regard, again, to educate? Because with the advent of COVID-19, everything else had to be on the back burner whilst we were dealing with COVID. And there's a lot of education, I suppose, that we were supposed to do that hasn't necessarily been done. And perhaps we are slightly waning in our awareness campaigns when it comes to HIV and AIDS, especially amongst young people.
Absolutely. The COVID-19 pandemic set us back in terms of the services that were provided to people living with HIV, in terms of what was happening in schools. The COVID-19 disrupted, some of the programs that were ongoing. So we are in catch-up mode. But to go back to the issue that you raised, a very important one, where children, adolescents are not necessarily told about their status and, would then, unwittingly put either themselves in danger or others. What we need to do is really accelerate and strengthen the programs that relate to stigma. There's no reason why nowadays anybody should be holding back, on their status or, being in a family where you don't want to talk about the HIV status of a family member, of a child. This relates to the kind of, parenting that we want to promote, the kind of, nurturing care that we want in any family, whether here in South Africa or anywhere. It's about the kind of the relationship that we want to have in families, and the way we care for each other. We relate to the family members, the friends, the community members who are affected by HIV/AIDS. There shouldn't be stigma. You should be able to take your medication and take care of yourself and take care of people around you in a way that doesn't impede on who you are, your ability to flourish, to grow. HIV status is something really that should become almost a normal, a normal thing. There's no reason why anybody should not be able to protect themselves and protect others around them because of an HIV/AIDS status.
Christine, we're going to end with more details to that plan and what we can expect. But before we get to that, what are some of the challenges currently hindering this progress or the process that we want to undertake to ending HIV/AIDS infections in children by 2030?
So we have the knowledge, resources are there. We said that, we know that. So what we need to do, and what seems to sometimes stand in the way of us, making progress, is the multi-sectoral, the complexity of having to deal with communities in where they are. We need to sometimes go the extra mile, to reach the young girl who is hesitant in coming towards a health facility or health center. That requires that we work, across various systems, platforms. You need to make sure that you reach these young girls in schools, you reach them in their communities. You talk to them, or you reach them in ways that they understand. We need to be more savvy, in terms of, for example, the way young people nowadays communicate. You need to make sure that you bring to them somebody with whom they can relate. So it's not, you don't deal with young people, with children, in the same way you would deal with adults. Sometimes they don't tell you what's happening to them. So you have to break through to them. And so this is what this alliance is about, making sure that we bring all the knowledge, all the capacity, all the resources that we have in a way that, allows us to break through to the challenges that are the challenges of dealing with younger people cannot express themselves as, in the way that adults would express themselves, and who are not necessarily visible in the more global AIDS response.
And just finally, Christine, just looking now at the launch today and what your expectations are, and of course, perhaps apart from what you've already kind of touched on, a little more in terms of what we can expect today.
So the launch actually has been postponed. We are not launching today, so we are continuing to raise awareness about the children, the adolescents who are left behind. We continue to raise awareness about the kinds of programs that we need to put in place to reach the children. And we were informed that the Minister of Health of South Africa would like the launch to take place at a separate time, not during the time of this conference. So we're building momentum today. Thank you very much for the opportunity to speak to you as well about this very disheartening situation of us knowing that there are about 90,000, if not more, children here in South Africa who we know are HIV positive, but we know also they are not on treatment, and we need to make sure that we find them. We need to make sure that we have the community-based outreach and services to support them as they grow. We need to know that they are in schools and not stigmatized, and will grow up to be, productive and healthy human beings that support the development of this country.
Christine Muhigana, thanks so much for your time. UNICEF South Africa's resident representative, talking to us about the South African Global Alliance. They obviously were meant to launch that plan to end AIDS in children by 2030. But as you heard there from Christine, that has been postponed, but they will continue to raise awareness around this very important matter. Disheartening, to use Christine's word, but important all the same.